Hi everyone, my name is Giam. I'm the Executive Director of the Asia Pacific Hospice Palliative Care Network. Firstly, I would like to give a big thank you to the organizers, Spring Hospice Center and Hope Kong Dong for Community Health. Congratulations to hosting the World Hospice and Palliative Care Day conference. Let me share about APHN. The APHN is a regional non-profit organization that has been serving as the umbrella body for hospice and palliative care in the Asia-Pacific region since 2001. In 2001, the APHN started with 14 sectors, and Vietnam is one of our founding sectors. By 2023, a resolution was passed and the total number of sectors joined APHN becomes 27. To date, we have over 2,500 individual members and over 250 organization members. It is my privilege to share the purpose and the spirit that guide the APHN. Since our founding in 2001, the APHN has stood as a bridge linking palliative care professionals, institutions, and communities across the Asia-Pacific region. Our purpose is clear and timeless. That is, to uphold dignity, hope, and peace for individuals, families, and communities impacted by serious illness across the Asia-Pacific region. This statement reflects our deepest conviction that no one should suffer alone, that everyone, regardless of who you are, where they live, deserve compassionate care that honors their values, relieves their pain, and bring comfort to their loved one. Over the past 2 decades, APHN has worked hand in hand with partners across the regions, building capacity, sharing knowledge, and nurturing leadership. From Bhutan to Philippines, from Timor-Leste to Japan, we have witnessed how collaboration can truly transform the landscape of care. As we look ahead, APHN remains steadfast in its mission to be an effective and trusted network, connecting people, strengthening systems, and inspiring the next generation of leaders in palliative care. Together, we will continue to uphold dignity, hope, and peace, ensure access to quality hospice and palliative care for all in the Asia-Pacific region. The theme for this year's WHPCD is powerful: Achieving the Promise, Universal Access to Palliative Care. Today, on the World Hospice Palliative Care Day, let's reflect on our mission and the path ahead. It's wonderful to see everyone in the conference. It reflects on Vietnam's journey, progress, and interest in palliative care development, a story of commitment, perseverance, and hope that we shall share in time to come. I've been asked to share on the World Hospice Palliative Care theme about Vietnam, Achieving the Promise, Universal Access to Palliative Care. Before we discuss, let me first ground us in the WHO framework for palliative care development. It is visualized as a house with strong foundations built on empowered communities and national policies. The pillars are education and training and access to essential medications. Both are vital to quality care. And at the top, the provision of palliative care services supported by research completes the structure. Together, these 6 elements ensure that palliative care is built to last, accessible, compassionate, and sustainable. Today, I'll be sharing a snapshot of Vietnam's progress in palliative care, the key challenges identified in the 2025 APHN Atlas, and how APHN can partner with your stakeholders to strengthen national capacity and integration. The Atlas is developed with data provided by around 120 consultants and leaders of national palliative care associations. The Atlas presents country-level insights guided by the latest WHO framework. It maps key indicators across policies, services, education, and access to medication, offering a clear picture of programs and persistent gaps across the region. Vietnam has made strong healthcare gains over the last decade, with universal coverage expanding. Yet, palliative care remains in the progressing phase, showing early institutionalization but uneven implementation. Extracted from the APHN Atlas for Vietnam, the country performs above average among low-middle income countries, showing steady advancement in health access and social development. I shall not go through in details of the map, but you can get a copy from the APHN Atlas. These metrics underscore that Vietnam has a strong foundation for expanding palliative care as part of universal health coverage, aligning with its national goals for equity, people-centered healthcare. Vietnam has made remarkable strides in advancing palliative care across multiple fronts. In 2023, the National Care Law formally included palliative care and end-of-life care at the primary care level, ensuring access closer to communities. The 2022 national guidelines emphasize on holistic approach, addressing physical, psychosocial, social, and spiritual care needs. Since 2019, the Vietnam Palliative Care Society has been a driving force for advocacy and training, while specialty recognition and formal training at Ho Chi Minh City University of Medicine and Pharmacy has strengthened professional capacity. Palliative care is now taught in 5 to 8 universities with growing nursing involvement. Service delivery. It is expanding with around 48 hospital-based units and emerging home care models, bringing care closer to the families. Regular national conferences continue to unite professionals and showcase innovation like this one today. Together, these milestones reflect Vietnam's strong commitment to build a comprehensive, compassionate, and sustainable palliative care system for its people. Like many low and middle income countries, Vietnam continues to face several systemic challenges in advancing palliative care. At the policy level, there is no dedicated national plan or coordinating body, and while guidelines exist, their implementation and evaluation remains limited. Discussion on advanced care planning may have begun, but no formal policy yet. In delivery service, most care remains urban-based, with limited reach in rural and mountainous areas. There are only 0.05 services per 100,000 people. This is far below the regional median. Pediatric and home-based care are still developing with only a handful of hospitals offering such services. Access to essential medication is another barrier. Opioid availability remains low, and rural facilities often lack authorization to store morphine. Local research and publication are still limited, restricting the evidence base for national planning. To move forward, suggestions include developing a coordinated national strategy, one that strengthens policy, expands services, ensure access to medications, and build a culture of research and evidence. APHN looks forward to collaborate with key stakeholders in Vietnam to move the country's palliative care development from progressing to established through an integrated approach. In APHN, we have education, capacity building, collaboration with stakeholders, opportunities for scholarship and bursaries, and much more. In terms of education, we provide free webinars across the year and also collaborative workshop with in-country trainings. For capacity building, we have our flagship program, the Lian Collaborative for Palliative Care, where we work with local institutions to capacity build. We also welcome everyone to join our Asia Pacific Hospice Palliative Care Conference in 2027 to reach out to like-minded regional healthcare professionals in palliative care. APHN also provides scholarships, bursaries, and awards to healthcare professionals that would like to advance in palliative care, especially true for our Cynthia Go Palliative Care Fellowship, where we will grant the in-country fellows a chance to develop into future leaders of palliative care. So do connect with APHN and join us as a member. Last but not least, I would like to share again the APHN Atlas of Palliative Care in the Asia Pacific region. You can download a free copy by scanning the QR code. Go to find it in the APHN website or purchase at Amazon. If you have any questions and potential collaboration, do look out to APHN and by scanning the QR code to join us in our social media. Thank you and have a good day.